everyone, my name is Junamisi Untowa, BSN1 from Section 11N. And for today, I'm going to perform a parenteral drug administration return demonstration using subcutaneous and intramuscular injection. The procedure that I'm about to perform is subcutaneous injection. Subcutaneous injection is the introduction of a small amount of solution by means of syringe and needle into the adipose tissue beneath the skin. Prior to the conduct of procedure, first thing to do is to check the doctor's order on the patient medication administration record. This is done to identify what kind of drugs to be given to the assigned patient, to identify the drug's name, its dosage, the route of the administration, and the time it is to be given. After that, we will going to perform a hand hygiene to deter the spread of microorganism and avoid the cross-contamination. To prepare a medication, we need to have a syringes. I have an insulin syringe for subcutaneous injection and a 23 gauge syringe for intramuscular injection. And also have a aspirating needle which is used to draw the medication from the vial, and we have the sterile water which will serve as the medication used in the demonstration. I also have a cotton balls. One is soaked in 70% alcohol and the other one is dry cottons. I have a hypodermic tray, and most important, I have waste receptacles here, and this is where I will dispose the used needles. So, to prepare medication for subcutaneous injection, we will need to have a insulin syringe. We need to open the sterile cap, take out the syringe, and cap the syringe. Now, draw the air into the syringe and draw air just with the exact amount of the medication prescribed by the doctor. And now, okay, and then inject the air into the vial, invert the vial, and draw medication up to the exact amount we needed. So now there are no air bubbles, so we can cap it and place it into the hypodermic tray. And now, write the drug name and dosage into the medication ticket and place it into the hypodermic tray. Yourself to the patient and verify the identity of the patient, and also explain the procedure to the patient. Good morning, ma'am. My name is Junamisi Untowa, your student nurse for today. Can I see your wristband? So, can you tell me your full name po?
Yes, my name is Sunny Jean M. Castro,
Your birthday?
June 23, 2002.
Now, perform hand hygiene and observe appropriate infections prevention procedure. Arrange the medication card on the hypodermic tray with the corresponding drugs. Now, observe which site would be used to expose and potential injection sites. Now, inspect the area for any bruising, inflammation, or edema. Best side could be the outer aspect of the upper arm, the abdomen, just below the costal margin to the iliac crest, and anterior aspect of the upper thigh. And now palpate and avoid any area that is tender. Ma'am, are you feeling pain in your abdomen?
No.
Okay, and to make sure that you have the right size of the needle, use the thumb finger of the hand to grasp the skin fold of the tissue and measure the fold from the top and to the bottom to ensure that the needle is half as long. Now, pull the needle cap and hold the syringe between the thumb and the forefinger as if you are holding a ball pen. And then now place the patient in comfortable position and document. The last procedure is the intramuscular injection. Intramuscular injection is the introduction of medication deep into the muscle tissue where a large network of blood vessels can absorb it readily and quickly. Preparation of intramuscular injection medication. So the doctor has ordered 5 milligrams of morphine sulfate to address the pain of a patient sustained from the recent car accident which has caused in a severe pain and injuries at his right arm. So before we could actually draw the medication from this vial, we first need to do a mathematical calculation of the exact dosage needed. So the doctor has ordered 5 milligrams of morphine sulfate. It should be divided with the stock on the hand, which is 5 milligrams per 1 ml. Okay, so now that we have the exact dosage needed, we can now draw the medication from the medication vial. Of course, we need to have the syringe with a gauge quantity needle. I'm gonna open this sterile pack. Now, connect the syringe into the aspirating needle. And now open the medication vial. Now that the rubber seal is exposed, we should clean its surface with a cotton that has been soaked in the 70% alcohol. Do this for at least 30 seconds. Okay, and then take the syringe and cup the syringe now, draw into the air to be drawn inside would be equal to the amount of the medication need as prescribed by the doctor. And now inject into the vial. Now there's not air bubbles, so we can just cup it and place it on the hypodermic tray and then write the drug name and dosage into the medication ticket and place it into the hypodermic tray. So now, check the doctor's order on the patient chart. And after that, introduce yourself to the patient and verify information of the patient and of course explain the procedure to the patient. So, good morning ma'am. My name is Junamisi Ontoa, your student nurse for today. And what is your name?
My name is Sunny Jean M. Castro,
And your age, please?
20,
And your birthday?
June 23, 2002.
Okay, ma'am. So your Dr. Melendez, has prescribed you with morphine to elevate your feeling of the pain. Is it okay? Okay, now select appropriate site for injection, vastus lateralis and deltoid muscle, or possible site for intramuscular injection. Examine the integrity of amount of patient muscle mass and palpate the muscle area. Inspect the area for bruising, inflammation, and edema. If the skin shows bruises or inflammation, use the other side. Now, help the patient to find comfortable position that will accommodate the injection site you've chosen and expose only the portion of the body. Now, this is her position. And then after that, apply gloves and use anatomic landmark to find the site again. For the ventral injection, place the heel of the hands over the greater trochanter of the patient hips and with the wrist almost perpendicular to the femur, point the thumbs toward the patient groin, point the index finger to the anterior superior iliac spine and index finger back along the iliac crest towards the buttocks. And now, disinfect the injection site in a circular pattern from inner to outer for about 2 inches. And now, hold the gauze pad between the third and the fourth finger of the non-dominant hand and uncap a syringe and hold the syringe between the thumb and the forefinger of the dominant hand as if holding a ball pen. Place your owner side of your non-dominant hand just below of the injection site and hold the patient's skin laterally about 1 to 1.5 inches. Hold the position until you center the needle. Aspirate the syringe by pulling back the plunger with your dominant hand. This is to determine if you hit a blood vessels. Then if blood appears, then it means that you have hit a blood vessels, and then remove and discard the needle and syringe and start over. So inject the medication slowly, the rate of 1 ml to 10 seconds, and wait 10 seconds and withdraw the needle. And now place the patient in a comfortable position and then document the procedure. Okay, ma'am, we are done with the intramuscular injection and I'm going to head out now so you can have a rest, okay? So please avoid massaging the area that I have injected with the medicine. It is okay? Okay, so thank you for your cooperation.
You're welcome.
And that would be all. Thank you.